Here's two of my little young girls enjoying their lovely new house. That's little Amy, and that's my little Daisy, and at the back we got Lily. But today I just wanted to mention some irritating conditions that rats can get that can be potentially very serious and cause a lot of distress to the rats. But the first thing I wanted to mention, I did mention bladder problems last time, that rats can get smelly or blood-stained urine and need antibiotics. But there was another condition that I'd forgotten about. But just a few days after I filmed the last health part of this series, one of our older rats, Dawn, became ill at night. It's always at night these things happen, just as you're going to bed. You can guarantee if a rat's going to get sick, it will be just as you're going to bed. She'd been out, she'd been fine, she was on some antibiotics for respiratory infection, and suddenly I put her back into her house and I realised she'd flopped down, she'd panting heavily, obviously not feeling well, and she didn't want to come out, but I left her a couple of minutes, I put the other rats away, and I came back and very carefully picked her out, and she passed this like urine, but it was jelly rather than liquid urine. And I remembered we've had this quite a few years ago, and the vet had said it was crystals in the urine, and the treatment was antibiotics and Metacam for the pain. And I always keep Metacam because with 14 rats you've always got someone who might need a painkiller, so it's best to have some in the first aid box. So we gave her the Metacam, and after a couple of hours she was absolutely fine. So we thought we'd take her to the vet first thing in the morning. If she hadn't improved, we would have taken her in at night, but she recovered quite quickly. As soon as she'd passed this jelly, she was fine again, and the whole episode was over in about 15-20 minutes. It wasn't very long. The vet anyway said it could have been the Bacterial that she's on for her respiratory infection, and that can cause crystals in some rats. So little Ellie's asleep right at the back in the corner there, very sweet. So just getting back to what I was saying, sorry. The other thing it can be is crystals that are formed in the kidney and the bladder, or or fragments of kidney stones. Excuse me. And that has a funny long name, which I'm going to put up, and I'm not even going to try and pronounce. So that was just another couple of things with bladder problems. And also I didn't mention, my friends with male rats reminded me, penis plugs, which sounds horrible, tends to happen with older rats and they need to be removed. But I've never done that, so that is something that you can just be aware of. It means your rat can't go for a wee, and obviously that needs to be, blockage needs to be cleared, because otherwise they would be in a lot of pain and a lot of trouble. I think skin conditions are something that are quite common. Now Bo, who's 3, her skin's gone very dry, and she did have some flaky patches, and we're giving her some vitamin supplements, and we also got some Dermagel, which we got from the rat warehouse, which we're rubbing onto her back on the patches, and that's really helped. I think her skin is just drying out where she's not eating as much, and she's just getting old. And I know some people will treat that with a little bit of olive oil on the food, and that's quite good as well. And we did try crushing some rat nuggets down with some olive oil in for her, and she's made a great improvement. But if your rats continue to scratch, or they have scabs and sores and things, then it's something a bit more serious. The most common thing is mites, which some people say the mites are always there, or all rats have mites, but they don't normally bother them. Well, the thing when it does become a problem is if the rats get stressed or their immune system is compromised because they're not very well, these mites can take hold. Moving house with rescue rats, every single time we get a rescue rat, they usually go into scratching overdrive after a couple of days. So what we do now is whenever we get a rescue rat in, we'll keep them separate from the other rats, and we'll immediately treat them with the little drops that we get from the vet. And these drops will kill internal and external parasites, so if there were any worms or anything inside, they would be got rid of. It kills every type of mite and lice that you can see, that the rats can get. It's very hard to see mites and lice and things, they're quite small, but you can sometimes, if you get a bright light and a magnifier, you can see them. Or if you take your rat to the vet can do a little skin scraping and put it under the microscope. But you can sometimes see little white specks or little reddy brown specks, or maybe little eggs. So that's not a very nice thing, but very easy to treat. And especially if your rats are continually scratching, bad scratching and little scabs, if it's got a hold, be little scabs maybe around their neck and around their face, then the most common thing it's likely to be is the mites. There's also ringworm, which is a fungus type infection, and that also causes a lot of scratching and irritation. I believe that spreads quite quickly. I've never seen it in a rat, I've only seen it in a horse, but I think you need to get to your vet for treatment. And also other skin conditions, maybe dermatitis, something like dermatitis like people get really. So it's always best, if you're not sure, to go and get it properly treated and just make sure you're doing the right thing for your rat right at the beginning, and it makes life a lot easier. The sooner you treat any skin condition, the quicker it will heal. A very nasty skin condition is the bacterial infection, and I'll put that name up for you as well. And this is often confused at the beginning, especially people think it's mites, because the skin is around usually the head and the face and the neck, quite nasty sores, but the skin can look quite red and inflamed as well. And the more the rat scratches, the worse this inflammation gets. And it can start from a wound that gets infected, a poor immune system, but and it can develop really nasty abscesses, and you need antibiotics very quickly. So if any sort of infection at all regarding the skin really needs to be looked at quite quickly. With abscesses, you should never try and drain them yourself. It can be very dangerous because you can actually push the infected fluid further into the body, which can lead to sepsis and death. So that is a very serious thing, and I hear a lot of people who treat abscesses themselves, and it really isn't a very good idea to do that. Another thing that rats can get is little cysts, just like little lumps under the skin that feel like little peas, and they're not generally anything to worry about, but again, just get them checked out with a vet. But sometimes they do contain just fluid, or sometimes it could be an infection in there, but not you know, these funny little lumps and bumps to come up on rats like they do on people. The more serious thing is the tumours, and rats can get malignant tumours or the benign non-cancerous tumours, and these can basically turn up anywhere on the body, but usually on the underneath, especially with the mammary tumours, which can actually affect male and female rats. Now sometimes they're attached, but usually with the mammary tumours they're usually just sort of under the skin, or the ones that we've experienced. Now if you've got an old rat, we don't have them operated on because of the bad experience we've had with tumours, especially with the rats that have got the immune system disorders and breathing problems. It can actually shorten their life. If you have young rats especially, and the tumours are quite small, then you probably will want to get them to the vet as soon as possible. The surgery is always easier if you have it done when the rats are quite, you know, while the tumour's quite small. But obviously discuss the risks of anaesthetic and for your particular rat. So just be aware there are different types of tumours. Male rats can get the testicular tumours, and also the pituitary gland tumours. Obviously that's quite a problem. It can affect the brain and everything, so that can cause the symptoms. I think I might have mentioned in the other video the problems with the head and the balance, and head tilted to one side. So just be aware that rats can get tumours like people virtually anywhere. So tumours and cysts and things, just get them checked out, find out what you're dealing with and what your vet recommends for you for that. I got little Rosie here sitting on my knee. She's emptied the sweetie bowl, and I'm just trying to think what else I was going to tell you about. can't have done it all already. We've got some, I have a little rat here, let's see if I can pick her up. Little Rosie. Rosie actually has a mammary tumour. Now it's quite large. You can see under here, you can see it under there. She won't move around. There is quite a large tumour. Now it doesn't cause her any problem at all. Now she's quite a frail old rat. She's not that old actually, she's nearly 2, but she's quite a frail little girl and she's got quite a few health conditions, so we didn't have her operated on much as we wanted to. It would have gone against our vet's advice for her, so unfortunately we've had to just let the tumour grow, and it's not causing her any mobility problems or any pain. But it's very sad because obviously I've never had such a young rat with a tumour, but it goes down to, again, the thing I was talking about in the last one on health, about the genetics. See, Rosie didn't have a very good start in life. The person who bred her was not a particularly nice person. They didn't really care about the rats, they just thought they'd make a bit of money out of breeding rats. They were separated from their mum too young. Mum was a Dumbo, Dad was a top-eared rat. And she is the most beautiful girl. Here she is, my Rosie face. There we go. She's lovely. Her and her sister, they came to live with us. Rosie's actually blind in one eye, so she's got a few things wrong with her. But we're just very sad that, you know, she has had so many illnesses in her little life. But she's the happiest little soul, and she's always running about and into things. So I think that the other thing that I really need to talk about that can be a real problem with rats is rats biting other rats. Now, I mentioned before in one of, I think it's in the food video, about the bio yogurt, how I kept my little baby rat alive on feeding her bio yogurt mixed with water. Well, rat bites, I'm just sorry, just thinking about how awful that was. The 12-week-old rat that we thought was going to die, she was just playing with her sister and they got a bit boisterous, and when rats are sort of a few months old, they're sort of struggling to see who's going to be in charge. And anyway, what happened was one of the sisters bit the other sister. There was a great big yell, and we took her out and we looked at her, and we could not find a bite anywhere. So she was frantically licking her tummy, and we just couldn't find anything. So she didn't seem to be in any pain. We put her back in the cage. Next morning we got up and she had the most dreadful abscess on her tummy, which actually burst before we could get her to the vet. It was that bad. She was on massive doses of antibiotics for 6 weeks, and I had to keep her alive by feeding her. I had to boil water and cool it and mix it with a little bit of bio yogurt and feed it to her on my finger because she couldn't eat or drink. And that was just a really horrible experience. So if you do hear some very sharp screeching and you've got rats that are like having a little bit of rough and tumble, do check them carefully, and if you can't find anything at first, come back a few hours later, because you can't always see blood, because the rats do a good job of licking wounds and they stop the bleeding, so you can't always see blood, and where their coats can be quite thick, it's very, very difficult to find a bite. But you know, always if you've got severe bites or there's any sign of infection or inflammation, always go and see your vet, get some antibiotics, and don't worry about little minor tiny scratches that stop bleeding straight away. Just keep an eye on them. Rats often get little scratches from each other and they will clean them and they will heal up, no problem. But anything at all that you're worried about, go and get some advice from your vet.